Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got the top mistakes you need to watch out for while squatting to avoid irritating your degenerative disc disease in your lower back. Hope you enjoy. So the first major mistake that people make with degenerative disc disease with squatting is they forget the whole theme or premise of why we're supposed to be squatting. And that is to engage the lower back and hip and lower extremity complex so that you can bend forward without irritating your back. Typically with degenerative disc disease in the lower back, pain is going to be aggravated when we flex or bend forward on the discs because the discs are in the front of the spine, and as we bend forward we're creating compression. So people that bend over even a little tiny bit to brush their teeth, to reach for something, they're typically using the smaller muscles because it doesn't take as much energy to try to support themselves in bending forward and allowing the back muscles to eccentrically lengthen as the spine bends, and it puts pressure on the front of the disc as the spine bends forward. A good squat trains us to hold a neutral spine and use the larger, stronger muscles of the legs and the hip complex so we can get down, keeping that spine in a neutral position. So we begin today's lesson by trying to learn what a neutral or pain-free position is for your lower back with your degenerative discs. Now, if you haven't yet taken the body analysis for your posture and mechanics at the Pain Free and Fit or Posture Size websites, I invite you to do so because it's a good quick check analysis to go through where your unique posture issues are, where your mechanical issues are. If you don't know how to properly engage, let's say, a weak multifidus muscle, which comes off the lower back and helps stabilize, or you have a dysfunctional transverse abdominis or internal oblique muscle, you really need to know how to engage them first so you can avoid an abnormal torque or shearing stress on the lower back that creates pain. We want to make sure that when we do squat, we keep an aligned body structure. So with that analysis, you'll determine if you have a tendency to lean to one side with the rib cage, to elevate one hip up or hip hike, which is very common with squatting, have a tendency to rotate your pelvis to one side. If you have a tendency to externally rotate one leg, that'll cause the glute on that side or the main buttock muscle to weaken. That's associated with hip hiking and compression of the discs on that side. It's also associated with too much muscular activity in the erector spinae or back muscles, which can create more pressure on the disc. So really get your body analysis down before you do this. With that being said, let's figure out where our neutral position is for our lower back. Once you've taken your analysis and know what to watch for, we want to go through a couple of motions. One of them is posterior and anterior pelvic tilting. We want to tilt our tailbone under and upwards by rotating our hips and feeling where there's a point of perhaps a little lower back discomfort when the tail goes up, and with tail under where we feel a little pull in your lower back discomfort with that. Those two extremes we want to divide in two and put our tailbone or our tilt right between the two of them, the midline position between too much tail up causes pain, too much tail under causes pain. I want to be right in the middle. That's my safe zone, away from the two pain extremes. I also want to think about if I have a tendency to lean my ribs to one side or hike my hip up, I want to make sure I'm keeping that side open when I squat, because my tendency is if I, let's say, have a tendency to walk or stand with my right leg out, that's going to cause an elevated hip and a rib that comes down pattern when I squat. So as I squat, I have to avoid that tendency. I want to keep my hips and ribs level. I also want to make sure that I'm avoiding any rotation. If I have a dysfunctional internal or external oblique complex, one tight lat muscle, for instance, from the back, the shoulder down to the lower back, that's going to cause a little bit of a torque or a twist of my rib cage in relation to my pelvis. If I have a tendency to externally rotate one leg, the pelvis is going to have a tendency to rotate away. So I want to keep these in check so that as I'm squatting, I don't have any rotation or twist to my pelvis or my ribs in relation to each other. My nose, my belly button, my pubic bone should all stay aligned as I'm squatting. Without that, even a millimeter of that torque can put stress on the disc and aggravate you. So once we understand what our tendencies are to watch out for them to keep a square and aligned body structure, and we've determined if we have tail under or tail up position at those extremes where our midline position is, then we're going to be ready to squat. We're going to make sure that our feet for our basic parallel hip squat are facing straight ahead and are spaced so that they're directly underneath the center of our thigh. That would be too wide for me, and that would be too narrow. Once I have that position, I'm going to hold my lower abdomen inwards. That's that transverse abdominis, the deepest abdominal muscle. That muscle attaches to fascia that connects with the multifidus muscles of our lower back. And that's going to cause a bulging out on the sides of those vertebrae, on both sides, on every level of vertebra. That helps to stabilize and lock that lower back into position once that tail is set at the proper position, so we don't have any excess motion in the spine. Squatting is going to be performed best when the spine is locked in a neutral position and all the motion happens at the hip and knees. We're then going to stabilize our entire core complex by making sure that abdominal muscles are tight. As if we're going to get punched in the stomach, we're going to tighten up those abs. And then we're going to move the thigh bones back in the sockets to initiate a backwards bend of the hips. Now, if you have a condition known as an anterior femoral displacement or anterior glide syndrome or upper thigh anterior malposition, it's an overactivity of your hip flexor muscles with weakness of the glutes or buttock muscles, so the hip doesn't stabilize itself in the socket. We have other videos on that that's been presented in a lot of our products on the Pain Free and Fit website. But to boil it down to one simple idea today, we're going to make sure that those hip bones, the prominent aspects of the side of our hip, are moving backwards in the socket when we initiate that motion. And the motion is we're going to drive our hips down and back, and we're only going to squat as comfortable as possible. If you notice as I do that, the entire motion is centered around pivoting around my knee and hip. My knees are not moving forward, they're bending, and the hip joint is allowing a rotation from my hip right through my ear. So if you notice, my head and mid-back and lower back all tilt forward as one unit. The mistake that a lot of people make with squatting is they have a tendency to keep their eyes fixed upwards. That increases the arch in the neck and likewise increases the arch in the back. That then changes that neutral position that we set in the lower back, compressing the back of the disc. We don't want that. So as we squat, our eyesight is going to follow a line that our chest is pointed in, which is going to look like that. So your eyesight's going to change from straight ahead to a point down about 3 feet ahead of you as you squat. Again, only as deep as is comfortable. If you can make a parallel squat, that's fine. As you notice as I'm going, the entire motion is centered around the hip joint. That's my strongest joint in the body. My glute muscles or my buttock muscles are spreading apart as those thigh bones move back in the socket. After the inhale at the bottom, I'll exhale, squeezing the buttock to come up. Now here's the key. I haven't lost any of that set position in my lower back. As I'm squatting, I'm avoiding losing the alignment by leaning to one side, by hiking my hip up to one side, by twisting or rotating to one side, by tilting my tail up or down as I go down. People with disc problems have a tendency to have a lot of instability in the back, meaning as they bend, that spine's moving too much. We want that spine to be a concrete block, no motion. It's stable, it's in a neutral position. All the motion is in the hips. A lot of people as they squat, if their back is really acute, meaning it's very painful in this particular week or couple of days, a regular parallel hip squat's still going to produce a shearing stress forward on the vertebrae and discs, and it's going to create a lot of tension in the erector spinal muscles to hold the spine in this position. And sometimes those spinal muscles are too fatigued from trying to brace and help support the disc when it's aggravated. So if your case of your lower back and your degenerative disc is really active right now, meaning it's really painful, I would then modify this to a sumo squat where you're going to take a wider stance, making sure the feet are forcing or pointing outwards. And as we squat down now, there's less of a forward tilt, but more of a straight up and down squat. It's a little different motion. The spine is more vertical in this position with a sumo squat, and there's a lot less of that shearing force on the lower back, a lot less erector spinae tension trying to hold the back forward compared to a regular parallel hip squat. So those are two modifications you can use. As you're squatting, it's also very important to understand we're trying to not only learn good mechanics to prevent stress on the disc, but we're trying to build up over time the endurance strength of the extensor muscles, meaning the hamstrings, the buttocks, the lower back muscles, because these muscles are typically dysfunctional. Some are weak and some are overactive. So as you practice your squat and you increase repetitions every other day with a day's rest in between, we're going to try to increase the length of time that we hold the bottom position. Now again, that's not holding our breath, but that's holding the bottom position. we breathe normally with our diaphragm. Our upper tummy is moving in and out as our lower tummy, under our belly button, is still pulled in to engage that core transverse abdominis. And you can start with 5-second holds at the bottom and eventually build up to 30-second holds. You're going to really feel the legs and the hips and the buttock muscles and even the lower back muscles become fatigued, but it's not going to cause disc pain because you haven't changed that angle on the disc. And if you increase those reps over time, you're also going to be increasing your endurance capability. It's going to help with your pain. So you can improve with squats with increasing repetitions at a normal cadence, meaning about a second or two down and a second up. You can increase the isometric hold times of the bottom position, making sure you're not losing any of your form. That's the whole key with all squatting. We're focused on making sure our alignment is set and we haven't lost that neutral spine tension. Or you can also increase the cadence, making your squats really slow, perhaps taking 5 or 10 seconds to go down and then 5 or 10 seconds to come up. The slower you go, you're making the muscles work a lot. You don't need to put on extra weight behind your back or hold heavy dumbbells. All those things are going to increase the load or stress on degenerative disc. So you can still get a great leg workout, great hip workout, great lower back muscular workout without irritating your discs. If you like what we're sharing here with these squats, put them into your routine at home. Watch how it helps with your lower back. This concept of squatting comes right out of our new program, the Fast Track method of healing exercise for degenerative disc disease in the lower back. You can go to the Pain Free and Fit website. We have more there on that program and others. If you'd like to help me share this vital information with others, give me a thumbs up below, leave your questions or comments, and I'd be delighted to get back to you. And finally, if you enjoy this kind of video series, help me spread it to more people that are suffering with degenerative disc disease. Subscribe to our channel, get more of this information. Piece by piece, you can start making a difference in how your degenerative discs are treating you, and you can live the pain-free and fit lifestyle.